Men bu surki umuman kerak emas.
Bu efirmi?
Ha? Prямom efir bo'ladi. Ha.
Kirishga ulgurmagan. Yepa.
Telefon berib tura olasizmi aka?
Ochish kerakmi?
Ha.
Qarab turganini ko'rmoqchimiz.
Ha. Gorizontal olibdimi?
Tohirga rasmini o'qib, qo'lni
Uni oqsam ham bo'ladi. Tekshirib qo'yapti. Temperatura.
Yok da ne? Boş tutar.
Yerde. Osmona. O'nta odam bor. Yo'g'a, pastga tushaymi? Yo'g'a, hop. Hali lozim bo'lgan. Bilet siz mana pastga tushib ola qoling.
Shunday uchtaga bo'lingan. Birinchi qatorda o'rtada o'tirib
Светлана.
А.
Что,
Sal teparoq beringlar, ko'zni prямom beradi. Asosiy fokus mana bu yerda bo'lsin. Chiroqni. Chap tarafdan, o'ng tarafdan. Qo'lini sen joy bo'shmagan.
Madriddan kutib o'zbek klub.
Ha, bo'ldi.
Kim o'tirmoqchi edi?
Men
Sizmi? O'tirib turing.
Sometimes a single word can change your whole day. Sometimes it finds a place in you.
Neighbor, please, could you pick up my child from kindergarten? I'm running a bit late. I'll be there soon. Okay, thank you so much.
Even small acts of help are proof of kindness.
That's enough now, Lola. Don't keep crying. Everything will be okay.
Sometimes the most important thing is simply to listen.
I don't have any other money. This one covers all I have to make a living. It's okay. I let it go.
Sometimes even a person who seems bad can do good deeds.
Please stay here. Thank you. We're glad to have you.
Then he's regained consciousness.
Thank you. We're glad to have you.
Thank you for listening to me. We're glad to have you. Thank you. My sweetie. Thank you, neighbor. We are glad to have you. You're welcome.
It's good that there are kind people. It's good. I'm glad you're here. I'm glad you're here. Yes, my dear. Did you arrive safely?
We're glad to have you.
These are simple words, but they can change lives. We are glad to have you. Profi University.
Assalomu alaykum, aziz mehmonlar, hurmatli spikerlar, aziz shifokorlar, tadqiqotchilar va ishtirokchilar. Sizlarni ilg'or klinik amaliyot bo'yicha birinchi Hindiston-O'zbekiston xalqaro konferensiyasida samimiy qutlash biz uchun katta sharaf va mamnuniyatdir.
Good morning, dear guests, respected speakers, esteemed doctors, researchers, and participants. It's our great honor and pleasure to welcome you all to the first India-Uzbekistan International Conference on Advanced Clinical Practice.
Endi esa ochilish nutqi bilan so'zga chiqish uchun konferensiya mezboni va universitetimiz rahbarini sahnaga taklif etishdan mamnunman. Psixologiya fanlari doktori, professor, O'zbekiston Fanlar akademiyasining to'liq a'zosi, akademik va Profi University rektori janob Shamarov Hayrat Bahromovich.
Now, it's a great respect to invite our host and the head of our university to deliver the opening address. Doctor of Psychology, Professor, full member of Academy of Science of Uzbekistan, Director of Profi University, Academic Mr. Shamarov Hayrat Bahromovich.
Здравствуйте, дорогие участники, незабываемые в истории впервые проводимые научные международные конференции. Почему я это говорю? Поскольку эта конференция между Индией и Узбекистаном, совместная международная конференция, впервые проводится, именно по медицине, впервые проводится в Узбекистане. Я приветствую прежде всего гостей. Разрешите представить пришедших, приехавших к нам в гости гостей. Господин доктор Пурвис Грэнд, доктор медицинских наук, профессор, учредитель компании Profi University. Господин доктор Хамиш Ганди, доктор медицинских наук, профессор, известный хирург международного значения. Господин доктор Чак Роора, доктор медицинских наук, профессор, известный онколог международного значения. Санджей Шинтилал Биора, доктор медицинских наук, профессор. Господин доктор Баймурадов Шрат Абджалилович, доктор медицинских наук, профессор, доктор медицинского университета, известный хирург-стоматолог. Госпожа доктор Ризаева Севара Миргуловна, доктор медицинских наук, профессор. Естественно, основатель, учредитель, по-узбекски мизбон, хозяин, господин Бекташ Бигматович Хатанов. Я не буду долго времени занимать. Сейчас мы будем слушать очень интересные доклады. Я не буду говорить о роли медицины, я не буду говорить о роли здоровья для человека. Единственное, напомню пословицу, немецкую пословицу. Деньги потерял, ничего не потерял. Время потерял, много потерял. Здоровье потерял, все потерял. Именно на страже здоровья, самого ценного для человека, это медики. Это самая гуманная профессия. Люди этой профессии преданно служат своей профессии. Я желаю успехов всем здесь, желаю присутствующим, прежде всего гостям, которые соизволили именно участвовать и провести эту международную конференцию. Я опять напоминаю, что впервые проводим мы конференцию совместной Индии и Узбекистана. Я желаю студентам быть такими же известными учеными, которые сочетают в себе не только ученость, не только науку, не только теорию, но и большую практику. Они сочетают и практику, и теорию вместе. Я желаю успехов всем присутствующим, как сейчас, так и в дальнейшем, в вашей профессиональной деятельности, а студентам формирования хороших, прекрасных кадров. Спасибо за внимание.
Endi navbat Hindistondan tashrif buyurdi. Endi esa bugungi tadbirimizning tashkil etilishida, shuningdek, Hindiston va O'zbekiston o'rtasidagi uzoq yillik hamkorlik va tarixiy aloqalarni davom ettirishda muhim o'rin tutgan Profi University asoschisini sahnaga taklif qilaman. Janob Xatamov Bektosh Begimatovich.
I would like to invite the person who has been playing an important role in bringing us together and continuing long-standing cooperation and historic ties between India and Uzbekistan. Mr. Khatanov Bektosh Begmatovich, the founder of Profi University.
Thank you very much. Distinguished guests, esteemed colleagues, honored delegates from Ruby Hall Clinic, Shah International Hospital, Tashkent Medical University, and the Walnut Drug companies. Ladies and gentlemen, Assalamu alaikum, namaste, good morning. It is a great honor and privilege for me to welcome you all in this historic occasion. the first Uzbek Indian medical conference here at Profi University. Today marks a significant milestone on the journey towards fostering international medical collaboration and advancing healthcare excellence in not only in Uzbekistan, but also in Central Asia regions. First and foremost, I would like to express my deepest gratitude to our distinguished colleagues from Ruby Hall Clinic, India, for traveling this distance to share their expertise with us. Your presence here today demonstrates the universal commitment of medical professionals to transcend borders of in the pursuit of knowledge and a better patient care. I extend my sincere appreciation to our exceptional speakers who will grace this stage today. Dr. Clovis Grant, our esteemed cardiologist, who will discuss contemporary approaches in clinical cardiology. Dr. Himish Gandhi, specialist in robotic urology and uro-oncology, who will enlighten us on modern, minimally invasive surgical techniques. Professor Vanradov Shukharab Jalilevich, Rector of Tashkent State Medical University, who will share insights of surgical treatment of vascular deformities. The Dr. Chokawara, our oncology expert, who will present our contemporary oncological treatment strategies in clinical practice. Professor Rizayeva Sevara from Profi University, who will discuss modern orthopedic treatment approaches for patients with facial defects. Dear speakers, your dedication to medical education and your willingness to share knowledge is truly commendable. I also to thank you, our university and SHOP International members, medical students, and all participants who have made this conference possible with a hard-working and commitment. Dear guests, healthcare knows no boundaries. The challenges we face, whether in cardiology, oncology, neurosurgery, or other fields of healthcare, are universal. However, the solutions, innovations, and approaches can vary significantly across different healthcare systems and geographical regions. This is precisely why today's conference is so valuable. The collaboration between Uzbekistan and India in medical field represents a meeting of two rich traditions of healing and innovation. India has emerged as a global leader in medical tourism, advanced surgical techniques, and affordable, high-quality healthcare delivery. Meanwhile, Uzbekistan is rapidly modernizing its healthcare infrastructure and medical education system, eager to adopt always believe that medical education requires exposure to global standards and international partnerships. Today's conference is a testament to commitment and starting point of great medical collaboration. This is just the beginning. I envision the first Uzbek Indian Medical Conference at the foundation of an ongoing partnership that will grow stronger with each passing year. Together, we can elevate the standard of medical care in Central Asia and contribute to global medical knowledge. Once again, thank you very much, dear colleagues, guests, and special gratitude goes to my parents, my wife, and all you participants. I'm glad to have you. Thank you very much.
Endi navbat Hindistondan tashrif buyurgan aytamiz. Doktor Profi tibbiyot fanlari doktori, professor, zamonaviy klinik amaliyotda e'tibor kardiologik yondashuvlar mavzusida ma'ruza qiladilar.
Now, it's our pleasure to give the floor to our distinguished guest, doctors from India, who is welcome them. Dr. Profi Doctor of Medical Science, Professor, who will deliver a presentation on advanced cardiological approaches in modern clinical practice.
Good morning, everybody, and thank you for your hospitality today. We've traveled a long way to come and be with you, and we look forward to taking this project forward. We want to partner with this university and produce something really great from it. I know we are all charged up to do something nice and great, and I can promise you that Ruby Hall and this university will move forward to greater things. As far as Ruby Hall is concerned, let me tell you something about Ruby Hall. Ruby Hall started nearly 70 years ago by my father, and it was a two-bedroom hospital, as I call it. From two-bedroom, we have now grown to 900 beds, and we are today one of the most modern hospitals in the whole of India. We have 5 hospitals in the city of Pune, and we are building the 6th hospital now. We employ nearly 4,500 people who work at Ruby Hall. And the main thing that we want about Ruby Hall today is it's structured as the most modern hospital in the whole of India today in technology. So I'm going to talk about the technology that we have brought in. Not only do we have main Ruby Hall, but we have many units all around the state, including all these various cities, all with MRIs and CT scans. We've got total 4,500 people, and Ruby Hall specializes in cardiology. We did the first angioplasty in India in 1987. I don't know if you all know what is angioplasty. Angioplasty means when you have a blockage in the artery of the heart, you put a balloon and open it up. So the first angioplasty in India was done in 1987. Since then, we have completed 160,000 angioplasties and more than 500,000 angiographies. We've also got the largest oncology or cancer center in the country. We have more than 200 ICU beds. So you can see that Ruby Hall is one of the largest hospital groups in India. We specialize in cardiology, as you can see. We have done more than 45 heart transplantations at the hospital. So this is the angiography unit or cardiac angiography setup. Now why is this setup important? This setup is important because if for any reason you have a complication or something goes wrong, you can convert the angiography setup into a theater and you can operate within 5 minutes. So you don't have to move the patient out. So this is a huge advantage that we have at Ruby Hall Clinic. And very few hospitals have this special type of cath lab. We have these special theaters available also for spine surgery, thoracic surgery, brain surgery, and so on. And this, you can see, this is what the angiography looks like. That is the normal angiography of the heart, where you've got all clean arteries. And you can see here there is a stent or a spring put in. So when you have a blockage in the artery of the heart, to keep the artery open, we put a little spring. The spring is called a stent. We can also find out how the stent has been implanted properly. So we can get beautiful pictures like this. So we have got what is called a dynamic coronary angiography. So we can actually see how the wire goes in. So you can see that this is the wire going in the artery of the heart. That wire is going right inside the artery of the heart. It's going down. And you can exactly pinpoint where you want to go. So we have got this new thing called dynamic angiography, where we can actually go into the arteries of the heart. And then once we are there, we can do the angioplasty. We also have what is called as intravascular ultrasound. That means you can put a probe in the artery of the heart and actually see where their blockages are. So this is a normal artery and this is the diseased artery full of calcium. So you can see these beautiful pictures like this, you can see of the coronary arteries. And this is a well-opposed stent. You can see that that's the spring, and this is a mal-opposed stent. That means the stent has not been implanted properly. So then you need to go in and re-put the balloon and open up that artery. We have got what is called as TAVI procedure. TAVI means trans-aortic valve replacement. So in the past, 15 years ago, when your aortic valve was narrowed, so the valve was narrowed, what we used to do, we used to go in, cut the chest and put an artificial valve in. The artificial valve used to last for up to 20 years, 22 years. Nowadays, we don't do this anymore. What we do is a TAVI procedure, or we put a stent in the valve itself. You can see that that's the valve, and that is the stent going inside. So without cutting the chest, we go from the femoral artery. We have done 5,000 such patients. So we don't need to cut the chest anymore. So this is a big advantage. It is called a trans-aortic valve implantation, or TAVI procedure. So this is a new procedure also being carried out at Profi Hall. And you can see that this is the aorta. And in the aorta, we have put the new TAVI valve. So this is what the procedure is all about. That's the aorta, and there goes the TAVI valve that goes into it. So there is no surgery, no cutting of the chest. So this is a big advantage that we find in patients. And here again you can see this is the aortic valve, and that is the TAVI procedure which is fitted there. This procedure takes only about 40 minutes. Next morning the patient goes home, and the TAVI lasts for at least 15 years. So this is a great procedure that we are now doing at Profi Hall. We also have a new technique for brain. So we have got what is called as a stroke protocol. Stroke means one of your hand or one of your legs suddenly doesn't start working. In that situation, we have a biplane special cath lab. That means there are two planes like this. We take the person into the cath lab, and then where the clot is, we find the clot and we suck the clot out so that the stroke doesn't progress and the patient becomes normal. We can also put stents or springs in the brain. So even this technology now is available at the Profi Hall Clinic in Pune. Very few hospitals in the world do that. So we have taken Ruby to the technological peak of the world today. I know my colleague 1 month ago, he was in charge of this cath lab, same lab, suddenly developed loss of his hand and loss of his leg. Within 15 minutes, he came to Profi Hall Clinic. We did an MRI. We found that he had a minor stroke. We went inside. We sucked out the clot. And 3 days later, he came back to work and started working again. So this type of technology now is available in the city of Pune and Profi Hall Clinic. And soon we should bring it here too. So you can see this is the technology I was talking. That's a spring in the heart, in the brain itself. So the brain has got a spring over there, which has kept the spring open. So these are the type of things. This is an aneurysm which we closed, which is there. Aneurysm, we remove the clot without surgery. You see, that's a big swelling in the brain, and that's gone. So these sort of things are going on now at Profi Hall. Now in 1958, when somebody needed a pacemaker, we had to cut the chest and put the pacemaker in. Sometimes the pacemakers were 6 inches big. So we had to make a big incision, put it in. It was a big surgery. Nowadays things have changed. The pacemakers have become smaller, 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 and now it is the size of just this size. And it's like a bullet. So you see this? It's just like a bullet, and you shoot it in. Once you shoot it in, it takes about 15 minutes. No cutting, no pocket, nothing. The pacemaker just goes in. Where is this slide? Oh, so we just go back. So this is the new leadless pacemaker I was talking about, where we just shoot the pacemaker. Now, at Ruby Hall last month, we have done a patient where we have paced both the atrium and ventricle using the new technology. So you can put one lead into the atrium, one lead into the ventricle, no pocket at all, and the patient goes home the next morning without any surgery. So this is the leadless pacemaker that we have got. We've also got a special machine which we have installed, and this is for cardiac laser. So what happens is, if you have a stent or a spring in the heart, and after 10 years or 15 years, the stent or the spring is blocked or gets blocked, we can take the laser and put the laser in and completely open the stent or the block without surgery and not put another stent in. So you can see this is the new machine that has been installed. It's low wavelength. And this is a patient whose stent has got blocked. You can see over there. And then what has happened, we have opened the stent completely with using the new laser. So we have not put another stent. We have just put the laser in, lasered it, and within 20 minutes the artery is fully open. So we can do things like this, which very few hospitals are able to do. And this is the cardiac laser I was talking about, and that's the laser cutting the atheroma and opening it up. So this is a laser atherectomy, which we have installed about 6 months ago at the Ruby Hall Clinic in Pune. Full spectrum of morphology, atherosclerosis can be completely open. We can cut calcium also and use it for restenosis. So this is the laser going, photoablation, completely goes, opens the artery and improves the vessel. So this sort of things are now possible in Ruby Hall Clinic. So photomechanical. We've also got what is called as the CyberKnife technology. Now CyberKnife is a new machine, a new technology. There are only 2 machines in the whole of India also. What CyberKnife does is that if you have a cancer, then it will kill only the cancer and not damage the tissues around it. For example, if you've got a tumor in the ear, or acoustic neuroma, what people have, the present treatment is surgery. You go and operate and take out the tumor. In Pune, in Ruby Hall, what we do, we simply take this new machine, CyberKnife, and we take the patient into the CyberKnife room. It works on complete AI. And we simply put the beam on. 20 minutes, he comes out of the machine, the patient is completely cured. Similarly, trigeminal neuralgia, where you've got the trigeminal nerve is very active. You can also use it for trigeminal neuralgia. If you have a tumor in the brain, very close to the eye, you want to protect the eye and not damage the eye, you can use this. We have done 950 patients already with this new technology, and this technology is very, very advanced. So we also have what is called as the new Da Vinci robotic system. We had the old Da Vinci robotic system at Ruby Hall, where we have completed more than 1,000 patients. Now this is the more advanced system that has come in about 2 to 3 months ago. We are doing 2 to 3 operations on this. The great advantage of this is there is no incision. It's very good for abdominal surgery, some type of prostatic surgery. So this advanced treatment is now also available for your patients. It's also got a lot of gynec applications for tumors removal in the stomach. So this new technology is also available and without any cutting of the patient. So again, next day the patient goes home with this advanced robotic system. We've also got RASM, but my colleague is going to talk about RASM, so I will not talk much about it. It's mainly used for prostatic surgery. I'm sure Dr. Gandhi is speaking next one. I won't go into this particular area, but it's a very beautiful system. We have got Modulin, the most advanced treatment for kidney stone, so we can break kidney stone without damaging the kidney. I'm sure Dr. Gandhi will also talk a little bit about it. We have the most advanced laboratory system in the world, where we can do 1,500 tests a minute. So this is a complete laboratory system which has been now installed at the Profi Hospital. We have what is called as digital PET system. That means it's a system to pick up very early cancer. So the person goes into this PET system, digital PET, and you can pick up very early cancers, which is picked up very early and then treated. So we have got the most advanced digital PET system, and we'll be the only hospital in India to have 2 PET systems. The new one is just getting installed at the moment. So we'll have 2 PET systems for very, very early diagnosis of various types of cancer and treatment as well. 1 year ago, we installed the world's fastest CT scan or CAT scan, as you know. A normal CAT scan works at 150 cycles per minute. This one works at 1,150 cycles per minute. And if you tell me, ask me, what is the advantage of having such a fast scanner? Well, the great advantage of this scanner is that it can do a full cardiac CT scan in 10 seconds. So you don't need to do angiography anymore. You don't need to go to the cath lab and do an angiogram at all. You just put the patient in the CT scan. This is the first machine in the whole of Asia. Comes from Siemens of Germany. And the main advantage is, number one, no sedation is required for children. Children just go inside 1 second and they come out. So there's no need of any anesthesia for the child. This is a great advantage. Number two, you don't need to give a beta blocker to slow the heart rate down. It can do it at any rate. Number three, the radiation is like only taking 2 X-rays instead of the old technologies, which is 40 X-rays. And number three is that the dye that is given, instead of 100 mils, we can do it in only 20 to 30 mils. So it's a big advantage using this new CT scanner. The CT scanner has become very popular, and we are getting patients from all over the world, from Singapore, from Dubai, from Africa. One patient came to Pune from Canada, another one from Australia for the CT scan. So this is the new technology that is now available. This is the first machine in the whole of India. And you can get, this is a picture of the brain. You can see such beautiful pictures of the brain using this technology. This is an aortic stent, that is a stent in the aorta. You can see it so beautifully, like the stent over there in the aorta. You can see the renal arteries, how beautifully they are shown. This is the kidney arteries with this new technology. Beautiful pictures. And this is the heart. You can see the heart so beautifully demonstrated. Each artery is very well demonstrated. You can see these beautiful pictures as if the heart is like an anatomy book. So you're getting these type of pictures which are never seen before in medicine. So this is a surgeon has done a bypass graft. So you can see that's the aorta. From the aorta, each and every graft that the surgeon has put in, you can see. So this is from the aorta, the grafts that are put in, again the graft. And look at the clarity of the grafts. You can also make out whether the graphs are working or not working. So this is a huge advantage of using this new technology that is now available in Pune city. You can see the leg arteries beautifully demonstrated. Each leg artery you can also see, and this is without putting a catheter, without putting a tube. You are getting pictures like this, without totally non-invasive. Again, this is a lower limb. You can see the pictures. This is the heart again. And you can see these are the little blockages coming up. Goes in the machine and comes out within a few seconds. So there is no anesthesia. These are some more pictures. You can get beautiful pictures like this using this technology. This is a partial anomalous pulmonary venous drainage or ASD. You can see the aorta. The aorta is completely blocked over down. There is no flow below that going to the leg. So you can see pictures like this. This is an emergency and needs urgent intervention. So you see the aorta and no blood going down. The aorta is the main pumping chamber which is coming out of the heart. And here you can see what is called as a dissection of the aorta. That means the aorta is torn. You see, that's the aorta, and there's a double shadow there. You've got one shadow here, one shadow there. So there's a double shadow over there, where the aorta is completely torn. And when you get in the back and the patient is deteriorating, you must operate within 6 hours. If you don't operate within 6 hours, this patient is going to die. If you operate, the success rate is more than 80%. But it has to be done soon. It has to be picked up soon and operated soon. I will show you, this is a child with a tumor which we did. And you can see there's a large tumor in the abdominal area of the child. Again, no anesthesia was used. These are the brain pictures. This is in the ear. These are the lung perfusion studies you can also do using this new technology. This is the fat estimation of the liver. We are getting a lot of fatty liver nowadays, and you know fatty liver leads to cirrhosis. So you can pick up this fatty liver early, and there are new treatments available. This you can also pick up gout. This purple thing that you see is gout that has been picked up in this new technology, where the uric acid is high. So you can see beautiful pictures like this, where the uric acid is high using this new technology. This is lung perfusion, and you can bronchoscopy. So instead of putting a tube in the bronchus, you can take the patient, put him on the CT scan and see you've got a tumor right in the bronchus. The virtual bronchoscopy without using a bronchoscope. So this is the new technology also that is now being developed more and more. This is again the stomach. You can see gastroesophageal reflux. That's the stomach. And that is showing gastroesophageal reflux using this new technology. So you don't need to do a barium swallow or any of those old techniques. You just put the patient in this machine and you'll get pictures like this. So, what is this? Okay. This is a new device we have for getting the creatinine. So before we do a CT scan, we always check that the patient's creatinine is normal. So we have this device that can give you the creatinine within 1 minute. The patient just takes a tiny piece of blood and put it in this machine. So you don't have to waste time. The patient comes, gets his creatinine done, goes straight in the machine. Within 10-15 seconds comes out, the report is given to him. And that's the technology you have today. We've also got the fastest MRI in the world at Ruby Hall Clinic. And this is installed about 6 months ago. And it has got what is called as smart speed. Why do you need to do it so fast? You need to do it so fast because nobody wants to be in an MRI machine for 40 minutes and 50 minutes. So we bought this new machine, again the first in India, which has got smart speed technology. And what this machine does, it gives you excellent quality, but more than that, for a knee which used to take 25 minutes, we do it in 7 minutes. For a prostate, 40 minutes, 12 minutes. For an MRI stroke, 3 minutes. So we have brought the time down from 45 minutes to 5 minutes and 6 minutes using this new technology. This is a very advanced technology, and this is for the first time in India again has been installed at Profi. We can do MRI elastography, which is very good to pick up fibrosis of the liver. So we can treat the fibrosis of the liver because now there is a new treatment available for fibrosis of the liver. There are some new tablets which have come out. You can start using these tablets. This is showing a low-grade glioma. So we get beautiful pictures like this on the new MRI. So this is a carpal tunnel syndrome, which is there on the MRI. Vascular. This is HOCM, hypertrophic obstructive cardiomyopathy. So you can see this is the heart, and the heart muscle has become thick, and this is called as HOCM, hypertrophic obstructive cardiomyopathy. You can pick up these things very soon and start treating them, because even for this there is a new tablet that is available now, and it can cause regression of the hypertrophic cardiomyopathy. The old treatment was you used to inject alcohol into and cure these people. But nowadays there is another which can be used for these people. So this is hypertrophic obstructive cardiomyopathy, which I spoke about. Cardiac sarcoidosis, you can see sarcoid. So all these things you can pick up. This is analysis on the MRI. So these are the things which we used to miss only. This is constrictive pericarditis. You can see constrictive pericarditis, which we used to miss. And again, we can pick up these constrictive pericarditis. That is arrhythmogenic cardiomyopathy. So this needs to be treated because this can cause sudden death. Things like this are also needed. You can see there is a mass in the heart here, a large tumor there. These tumors can also be picked up using this new technique. We are the first hospital in Asia to have our own cyclotron. Now, what is a cyclotron? Cyclotron is a very complicated machinery that produces, that is used for the PET scan, and that produces FDA, which is produced in the PET scan. So this cyclotron is for the first time. Because of this cyclotron, Ruby can do all these various complicated tests like ammonia, PET, DOT, GABA, so on and so forth. So this is a very advanced technology. This cyclotron comes from Sweden. It comes with, it's very radioactive. It comes with 100 tons of concrete around it. It comes in trucks from Sweden. Then it is installed. And in addition to that, there are 12 feet of bunker. That means the bunker thick is 12 feet. So it has a bunker first, 12 feet thickness walls, and on top of that you have the concrete comes from Sweden so that there is no radiation leak. It's basically like an atom bomb. So you have to protect everybody and around it. But we have installed this machine at Ruby, and because of this, we are able to get this FDG, which is produced in-house, and now we are sending it to other hospitals as well. So this is the cyclotron. First cyclotron installed in the whole of India. This is another machine for prostate. Dr. Gandhi is going to show you and talk to you about it. It's a very advanced technology. This is started only 2 months ago, 1 month ago actually. We've also got the best PET scan in Asia, just getting installed. This is a Chinese equipment. I can find a lot of Chinese cars in this country today. So they have landed up in India as well. So we are advancing this, the new technology. So this is called as Pan Vision, and this is the new PET scan that is being installed. We've also got the most modern operating theaters. Dr. Gandhi will show you some pictures about this theater as we go along. But this is the latest technology that is available. Because of our traffic problems in the city of Pune, we are now using scooters to give the first aid when an ambulance call comes. So the scooter goes with the defibrillator and everything, goes to the patient, and then the ambulance follows once the traffic eases. We've also become completely paperless. The whole hospital has become completely paperless. And everything is available on an app. So from the app you can see where to park your car, to the time you go to your room, your this thing, everything is online and app-based. We've also got for diagnosing early cancer, especially in the stomach, where you've got this new technology called CARAG. that tells us where the cancer is so that the surgeon knows and takes the biopsy only from that part rather than a wrong part of the body. So this type of thing, you can see this patient was bleeding, Mallory-Weiss syndrome, a big clip. So we went and clipped the bleeding and the patient was cured. We've got luxury suites so that the patient is very comfortable when he comes to the hospital. Just like the Ritz-Carlton or any good hotel. So we want to make as comfortable as possible when he comes to a hospital. So this is a special area which we have. This is nothing to do with the hospital. This is a management building where we manage all the facilities, including generator backup, water treatment plants, administrative services, sewage plants, to keep the hospital running shortly. We are building a hospital now, it's 300 bed, and mostly it will be a cancer hospital. So this hospital is just coming up in the city of Pune. This is the 6th hospital, and hopefully we'll have the 7th hospital in Tashkent. One more important thing, this is a charitable trust. The hospital is not there to make money unlike other hospitals in India. Whatever the hospital earns goes back into the hospital for equipment and to help the for giving, remember that. So we do a lot of charitable work. We do about 2 to 3 charity every day here, completely free of charge. This is not a commercial hospital. We have done open heart surgery on children that are only 4 days old and send them home. So this is for underprivileged children. This is this little girl. The Prime Minister wrote back and called Ruby Hall and said, please get this surgery done. And when he visited Pune, he said, call the girl, I want to talk to her. And this girl has now become a policeman. Profi Hall has got its own metro station. The whole station is named and is touching the hospital. 40% of our staff now comes by metro rather than have a parking problem.